Hello and welcome back to Let's Learn English, your space to listen, repeat, shadow, and learn English at a slow and natural pace. I'm Michael, and I'm so happy you're here with me again. Today's lesson is going to be very practical and very useful because we will focus on English sentences you can use at the hospital. Hospitals can feel stressful. You may be in pain, you may feel nervous, and you may need to communicate clearly with doctors, nurses, receptionists, or even other patients. That is why learning natural, everyday English for hospital situations is so important. In this lesson, I will not only give you single sentences, but also show you how to use them in full conversations. I'll speak slowly, pause often, and encourage you to shadow me. That means you listen, and then you repeat after me. This will help you build confidence, practice your pronunciation, and prepare for real-life hospital situations. By the end of this lesson, you will be able to explain symptoms, ask questions about medicine, request help politely, and respond naturally to doctors and nurses. So let's begin. Imagine you have just arrived at the hospital reception. You see a receptionist at the desk. You walk up and begin the conversation. Listen carefully and repeat after me. Good morning. I have an appointment with Dr. Brown at 9 o'clock. Hello. I would like to see a doctor as soon as possible. I'm not feeling well, and I need some medical attention today. Could you please tell me which department I should go to? Now, the receptionist may ask you a few questions. For example, do you have an appointment, or is this an emergency? You can answer, yes, I booked an appointment last week. No, I don't have an appointment. This is urgent. I am here because of severe pain and I cannot wait. They may also ask, can I have your name and date of birth, please? You can reply, my name is John Smith, and I was born on the 12th of July, 1990. Now let's practice what you might say if you are waiting too long in the reception area. Excuse me, I have been waiting for over an hour. Could you tell me how much longer it will take? Is the doctor running late today? I don't feel very well. Is there any chance I can see the doctor sooner? Now you are finally called into the doctor's office. The doctor greets you and asks, what seems to be the problem today? Let's practice some natural answers. I have had a very strong headache for the past 3 days, and it's not going away. My stomach hurts after every meal, and I don't know the reason. I feel dizzy whenever I stand up, and I'm worried something might be wrong. I have been coughing a lot, especially at night, and I also feel very tired. Sometimes you may want to explain more details. For example, the pain started yesterday evening, and it has become worse today. I usually sleep well, but this week I have been waking up in the middle of the night. I have a fever, a sore throat, and I think it could be an infection. Whenever I walk fast, I feel pressure in my chest. The doctor may then ask about your medical history. Let's practice some useful answers. I don't have any serious medical problems in the past. I was treated for asthma when I was a child. I take medicine every day for high blood pressure. I don't have any allergies that I know of. Yes, I am allergic to penicillin. Now let's practice asking the doctor some questions because it's important to be active in the conversation. Doctor, what do you think is causing this pain? Is this condition serious? Do I need to take any tests today? How long will it take for me to recover? Are there any side effects to this medicine? Should I avoid certain food or drinks while taking this treatment? Is there anything I can do at home to feel better faster? Sometimes you might not fully understand the doctor's advice. In that case, you can politely ask for clarification. I'm sorry, I didn't fully understand. Could you please explain again more slowly? Could you write down the instructions for me so I don't forget? I'm not sure how to take this medicine. Could you show me? If you feel uncomfortable with the advice, you can express yourself politely. I don't feel comfortable taking such strong medicine. Is there another option? I would prefer to try physical therapy before surgery. I would like to get a second opinion before making a decision. Now imagine the doctor tells you that you need a test, maybe a blood test, an x-ray, or a scan. You can ask these questions. Where do I need to go for this test? Will the test be painful? How long will it take to complete? When will I get the results? Will you call me with the results, or should I come back to the hospital? Now let's move to the pharmacy, because many hospital visits end with collecting medicine. Here are some sentences you can use with a pharmacist. I need to collect my prescription, please. Could you explain how I should take this medicine? Should I take it before meals or after meals? What should I do if I forget to take one dose? Are there any foods or drinks I should avoid while taking this medicine? If you think something is wrong, you can say, "Excuse me, I think there may be a mistake with my prescription. Could you check it again? This does not look like what the doctor described. Could you explain?" Now let's switch roles. Imagine you are not the patient but the visitor. Maybe you are visiting a family member or a friend. At the reception, you can say, "Excuse me, could you please tell me which room Mr. Anderson is in? What are the visiting hours today? Am I allowed to bring food or flowers for the patient? How many visitors are allowed at the same time?" Once you are inside the room, you want to comfort the patient. You can say, "I know this is not easy, but you are not alone. I am here for you. The doctors and nurses are doing everything they can to help you recover." Try to stay positive. You will get better soon. Is there anything I can bring to make you feel more comfortable? Would you like me to talk to the doctor for you? Now let's practice conversations with nurses, because they are often the people you speak to most at the hospital. Nurse, could you please help me adjust the bed? Excuse me, could I get some water, please? Could you explain when the doctor will come to see me? I'm still in a lot of pain. Could I have some more pain relief? How often do I need to take this medicine? Is it safe for me to walk around, or should I stay in bed? Let's also practice expressing emotions, because hospital visits are full of feelings. I feel anxious about my surgery tomorrow. I'm scared the treatment might not work. I feel frustrated because I have been waiting for a very long time. I feel upset because I don't understand the instructions. It's difficult for me to stay calm when I don't know what will happen next. And of course, you can also express gratitude. Thank you so much for your kindness and patience. I really appreciate the care I have received here. I feel much better now after the treatment. I'm so glad the doctor explained everything clearly. I feel more confident about my recovery now. So far, we have practiced reception conversations, doctor-patient dialogues, pharmacy sentences, visitor conversations, and nurse interactions. But this is only part one. In the next part, we will go deeper into role plays, longer conversations, emergency situations, and more advanced expressions, so you can feel truly ready for any hospital situation. Now let's move into longer dialogues and real hospital role plays. These will help you understand how full conversations sound in English, not just single sentences. Listen carefully, repeat after me, and shadow the rhythm of the conversation. Imagine you are in the emergency room. You feel very unwell and you need urgent help. The conversation might go like this. Receptionist, good evening. How can I help you? You, good evening. I need to see a doctor immediately. I have sharp chest pain and it's very hard to breathe. Please sit down. We will call the doctor right away. Do you have any allergies? Yes, I'm allergic to penicillin. Thank you for telling me. Do you take any regular medication? Yes, I take tablets for high blood pressure every morning. Okay, the nurse will come and take you to the emergency room now. Now shadow this conversation again, slowly. Imagine yourself speaking with urgency but still politely. Another situation. You are talking to a nurse about your condition. Hello, I'm here to check your blood pressure. How are you feeling right now? You honestly, I feel very weak. My heart is racing and I feel lightheaded. Okay, please relax. I will take your blood pressure now. Do you feel pain in your chest at the moment? Yes, I feel pressure in the middle of my chest, especially when I breathe deeply. Thank you. I'll inform the doctor immediately. Notice how clear, short sentences help you explain your problem quickly. This is important in emergencies. Now let's practice a longer conversation with a doctor. Good morning. What brings you here today? You, good morning, doctor. I have been experiencing stomach pain for the past 2 weeks. Can you describe the pain? Is it sharp, dull, or burning? It feels like a burning pain, especially after I eat heavy meals. Do you also feel nausea or vomiting? Sometimes I feel nauseous, but I haven't vomited. Do you drink alcohol, coffee, or eat spicy food often? Yes, I usually drink 2 cups of coffee every morning, and I often eat spicy food. That could be contributing to the pain. I would like to send you for an endoscopy to see what is happening in your stomach. Will that test be painful? It can be uncomfortable, but we give medicine to help you relax. How long will it take to get the results? Usually, we get the results within a few days. After that, we can decide the best treatment. Now repeat each sentence slowly, as if you are in that doctor's office. Let's do another role play. This time you are at the hospital pharmacy. Hello, how can I help you today? Hello, I need to collect my prescription from Dr. Smith. Certainly. Here it is. These are antibiotics. Please take 1 tablet twice a day after meals. You. Thank you. How long should I take them? For 7 days. Even if you feel better, please finish the full course. Are there any side effects I should know about? Some people experience mild stomach upset. Drink plenty of water and avoid alcohol. Thank you very much for explaining. This type of dialogue is very common, and practicing it will make you feel more confident when you collect medicine. Now imagine you are visiting a family member after surgery. Hi, how are you feeling today? I'm still in pain, but it's a little better than yesterday. I'm glad to hear that. Did the doctor say when you might be able to go home? The doctor said maybe in 3 or 4 days, if everything goes well. That's good news. Is there anything I can bring you tomorrow? Maybe some fruit or a magazine? A magazine would be nice. It helps me pass the time. Okay, I'll bring you one. Don't worry, you'll feel stronger every day. In this situation, you are using English not only to speak about health, but also to show care and support. Now let's practice emergency phrases that are short and direct, because in emergencies, you don't have time for long explanations. I can't breathe. I have severe chest pain. I think I'm going to faint. Please call a doctor immediately. Help! I need assistance right now. My friend has collapsed. Please come quickly. She is not responding. We need help. There has been an accident. Call an ambulance. These are powerful, urgent sentences that you should practice until they become automatic. Now, let's move into follow-up appointments. Imagine the doctor asks you to come back after a test. Here's how the conversation may go. Hello again. How have you been since your last visit? Hello, doctor. I have been following your advice, but I still feel tired most of the time. I see. I have your test results here. The blood test looks normal, but your iron levels are a bit low. What does that mean? It means you might have a mild iron deficiency. I recommend iron supplements and a diet rich in green vegetables and red meat. How long will it take for me to feel better? Doctor, you should notice improvement in a few weeks, but please continue the supplements for at least 3 months. You. Thank you, doctor. I'll follow your advice. Now shadow that conversation again, slowly. Sometimes you might need to ask for documents or paperwork. Here are some useful sentences. Could you please give me a copy of my medical report? I need a medical certificate for my employer. Can I get a note to explain my absence from school? I would like a record of my vaccination history. How can I get a copy of my test results? Now let's practice language for surgery discussions. Doctor, do I really need this surgery? Or is there another option? What are the risks of this operation? How long will it take to recover after surgery? Will I be in pain afterwards? How many times have you done this type of surgery before? Sometimes you may need to express your emotions before surgery. I'm feeling very anxious about the operation. I'm scared of the anesthesia. I don't know how long I will need to stay in hospital. I'm worried about how much it will cost. But also, you can express trust. I believe in the medical team, and I know they will do their best. I feel safe here in the hospital. I know this surgery will improve my health in the long run. Thank you for explaining everything so clearly. Now let's practice some advanced patient-visitor interactions. Visitor, you look a little tired today. Did you sleep well last night? Not really. The nurses came in to check on me several times, so my sleep was interrupted. I understand. Hospital nights can be difficult. Do you want me to ask the nurse if you can have fewer interruptions tonight? That would be helpful. Thank you. Don't worry. I'll speak with them before I leave. In this conversation, notice how you show empathy and offer help politely. Let's move on to polite arguments, because sometimes patients and doctors don't fully agree. Here's how you can disagree respectfully. Doctor, I recommend starting strong antibiotics right away. Doctor, I understand your recommendation, but I'm worried about side effects. Is there a less aggressive option? We could try a lighter treatment, but it may not be as effective. I prefer to try the lighter treatment first, and if it doesn't work, then I will take the stronger medicine. Okay, that's possible, but you must return in 3 days for another checkup. Patient, that sounds fair. Thank you. See, you can disagree politely without sounding rude. Now let's review some very short but powerful hospital sentences for everyday use. I need to see a doctor. Can I book an appointment, please? Where is the emergency department? I feel very sick. I'm here to visit my friend. I need help finding the pharmacy. Can you please explain the instructions again? Thank you so much for your care. We have now practiced arrival conversations, emergencies, tests, pharmacy language, surgery discussions, emotional expressions, polite disagreements, and visitor interactions. That's a huge amount of hospital English, and you've done really well to stay with me until now. Remember, the key is to practice again and again. Shadow these sentences, act them out loud, and imagine real situations. The more you practice, the more natural your English will feel when you really need it. Before we finish, I want you to do one more activity. Think about your own country. How are hospitals there? What sentences would you most likely need if you visited one tomorrow? Maybe you would need to ask about the cost. Maybe you would need to ask about test results. Maybe you would need to comfort a family member. Write down 5 sentences that you think are most useful for your situation and practice them out loud. You can also share them in the comments below. Sharing will help you practice writing, and it will also help other learners see new examples. Thank you so much for spending your time learning with me today. Hospitals are not always pleasant places, but with the right English, you can feel calmer, more prepared, and more confident. This is Let's Learn English. I'm Michael, and I'm really proud of your effort. Keep listening, keep repeating, and keep believing in yourself. Don't forget to leave a comment with your favorite hospital sentence or with a sentence you created yourself. I'll read your comments, and I'll be happy to see your practice. Take care, stay healthy, and I'll see you in the next lesson.